So you mentioned the supply of vaccines for low and middle income countries. You're a professor of global innovation at the University of Waterloo. Could you share a little bit about what the outlook is for developing countries? We hear a lot in the news about what's going on in Canada, the UK, the United States, but in low and middle income countries, what's the outlook?
Yeah. Well, I think a lot of people are very focused on what's happening in their own countries right now. But I think one thing that this pandemic has really clearly shown us is how small the world really is. Even the most self-interested person or nationalistic government would probably agree with this by now. So this pandemic has shown us that viruses don't respect borders, and that we're all interconnected, whether we like it or not. And if we look at this from a broader perspective, whatever long-term solution we develop has to be built through a global lens. It's really the only way to effectively end this pandemic and prevent future ones. So we can only kind of border ourselves off for so long, right? And sure, we can wait till everyone in the world is vaccinated against COVID-19, but that'll have major economic and other repercussions. And it's just a matter of time before there's another emerging disease on the horizon, right? And that's partially why we're hearing so much right now about concepts of shared responsibility and global solidarity. But for many developing countries, this crisis is just getting started. And the human toll of a major COVID-19 outbreak would be orders of magnitude larger than any advanced economy. This pandemic is a huge threat to the world's poor. There's obviously the direct threat from the virus, but there are other looming secondary threats that are just as concerning, with a lot of new challenges emerging as the virus spreads into these countries, both social and economic. Right now, the pandemic is halting delivery of essential services such as antenatal care visits, attended births, delivery of childhood vaccinations, and access to family planning, which have been key drivers in recent global reductions in maternal and child mortality. And so these disruptions are likely to lead to major increases in preventable maternal and child morbidity and mortality. And new estimates from some of my colleagues at Johns Hopkins suggest that under a scenario in which COVID-19 causes similar disruptions to what we saw in West Africa during the Ebola outbreak, almost 1.2 million children and 57,000 mothers could die over just the next 6 months. This would represent a 45% increase over existing child mortality levels. And so it's also important to note that the COVID-19 playbook that wealthy nations in Europe and Asia and North America have come to know by this point, stay at home as much as possible, keep a 6-foot distance from the developing from each other, wash hands often. These will be nearly impossible to follow in much of the developing world, right? In poor countries, there are just fewer jobs that can be done remotely. The UN Development Program has noted that 75% of people in the least developed countries lack access to soap and water. Much of the population lives in high density urban settings with multiple people living under one roof, which could also make it much easier for the disease to spread. Income losses are expected to exceed $220 billion in developing countries, and with an estimated 55% of the global population having no access to social protection. These losses are likely to impact not only health, but education and human rights, in the most severe cases, basic food security and nutrition. The UN World Food Program, for example, they've warned that an estimated 265 million people could face acute food insecurity by the end of 2020. And that's up from 135 million people before the crisis. So these are really things, that I think we need to be looking at closely. Certainly from a health perspective, under-resourced hospitals and fragile health systems are likely to be overwhelmed. So as an example, Italy's health system has been overwhelmed with one doctor for every 243 people. Zambia, on the other hand, where I've done much of my research in childhood diarrhea, has one doctor for every 10,000 people. So there's a lot of concern right now. Confirmed cases in Africa have risen by more than 40% in a week. The testing levels are still very low, implying that many cases might be going undetected. About 415,000 tests meant that only 400 tests per million people had been carried out, which is much lower than it needs to be. So yeah, I think we're watching it very closely. There's a lot of concerns, but I don't want this to be all kind of doom and gloom either. There's lots to be hopeful about. For Africa's part, governments, healthcare workers, scientists, and local communities have valuable experience in containing outbreaks already. The population is much younger than in other parts of the world, with a median age of 19. And so the lower number of deaths we're seeing so far could be attributable to that or climate-related factors. I think what's even more likely is that most countries have already taken decisive action to slow the spread of the virus. So there's been a lot of examples of really good leadership, and they shut things down and went into lockdown relatively quickly, and they're ready to do more. There's still a lot we don't know, and like I said, it's still early in the process. So everyone's watching closely, trying to ramp up testing and health systems capacity, and putting plans in place to minimize some of those secondary effects that I talked about. But success really requires an international effort. Effective containment measures carry huge costs to the health system, to economies and livelihoods, and in a lot of low and middle income countries, that capacity just isn't there. So wealthy nations like Canada can help. For example, by making sure that critical supplies don't go to the highest bidder. We also need to include poor countries in the preparations, especially by devoting more foreign aid to building up their primary healthcare systems. And that's, I used to work for CEDA, for the Canadian International Development Agency, which is now Global Affairs Canada. And Canada's always been a leader in that space, and we continue to be today. So we should all be very proud of that. If a novel virus appears in a poor country, we want its doctors to have the ability to spot it and contain it as soon as possible.